I assume
Okay,
you all
okay,
get
we are there.
the voice saying that we're recording, so.
Yeah,
Mhm.
yeah, and we get then a choice of continuing or leaving the meeting, and boy, it's tempting, you know, but here we are. So here we are recording. This is our meeting of June 23rd, the last meeting of our present incarnation. I'm surprised that Al isn't here for his last meeting. Maybe he'll show up. Maybe he's out riding a bike somewhere like that other time. So before we do anything else, can we approve the previous minutes that I assume I sent out?
Yes, you did.
And were there any
Yes.
changes to be made?
No changes.
No,
Now, if Al were here, he'd find, you know, incorrect spacings and font changes and stuff, but he's not. So let's take them as they are. You say Brad's here. We might as well go ahead and see him since.
I
Are you
think
there, Brad?
there he is. He was
I'm
muted, Kat. He's unmuted.
Oh
now.
well, yeah. Well, what else is new? That's the deal. Everybody's muted all the time. Hi, Brad.
Hello there. Thank you for.
Oh,
letting
there you
me
are.
meet with you.
For sure. I'm gonna try to find your pictures. You wanna tell the rest of the board what all you're hoping to do here?
Sure. We have a shallow well. And
Wait, excuse me, I'm gonna interrupt to say that Brad lives in what looks like the last house down on West Pelham Road. Yes?
that's
the
right.
town line? Okay,
The
just
house
getting you.
that's set down. If you've been here long enough, you'll call it the Lion's House.
Oh,
'Cause
really?
They built it
Yep. Oh,
a
yeah.
long time ago. We've been there
Uh-huh.
27 years now.
Okay, I know that house. I've been in it.
So if you've been in the house, beyond the house, down a ways is a shallow well, built before the house was built. And recently we had the water tested and we were showing some level of coliform. And that prompted me to talk with Catherine about options and such, and also to talk with the testing people, which put us on a track for getting to see if we could get a well drilled. And I brought in Isaac from Henshaw Drilling, and we both agreed that our site is pretty difficult to get a new well in. We were looking at the north end of our site, but that was before I pulled out property line drawings. And I realized later that the only way to get to where he was suggesting was through the neighbor's property with a rather massive access road. And our neighbors are not thrilled at the idea of having a rather massive access road and expensive. It was more money than we could pay to put it where he was suggesting it. There was a second site he suggested, which was, we thought in the northeast corner of our property, but it turned out that's also in the neighbor's property. So I started looking for other sites, and the only one I can determine is fairly close to the road and closer to the septic than it ought to be. If I get beyond 100 feet, there's just no, from the septic, there's no buildable, there's no drillable site. And it's largely because of a combination of wetlands and the way the property drops down. I'm not convinced I can get to 75 feet. And my question to you is, what matters most? I'm trying to avoid the wetlands, I'm trying to avoid the septic, I'm trying to avoid the road and buildings. And they're all a balancing act. So I have a site that I would say is roughly 60 feet from the wetlands, a little higher than the road. It's very close to the property line. It probably puts it 20 feet from the road, because the property line is 17-ish feet from the actual edge of the road.
Oh, That's good to know. It looks, because in the sketch that you sent me, it looks like it's right on the road.
Yes, that really confused me for a long time until I found something that I found the pin and it's 17 feet off the road. So that's the right of way, which is
Okay.
different than the roadway. So call my site 25 feet from the pavement. And I would, before I go back to get Henshaw in to tell me where we can put it, I wanted to find out what you would say. But when I get them in, what I want to tell them is push it as far back as we can away from the septic. That seemed to be the highest priority to me, and I don't know whether that's right. If I go too far south,
Go ahead.
the ground drops off, and suddenly we can't get a truck in there.
Can you share, could you share your screen if we gave you permission to share your screen and
Sure.
show us all the picture?
Sure.
So bear with me while I figure this out.
And I'm gonna get on, I'm gonna join the meeting as my computer too. I think.
Oh, there we go.
So Brad, I think you should be able to share.
Yeah, I think
Yeah,
it's
yeah,
up
it's
now.
here. It's here.
The odd thing when I share my screen is I don't see what you're seeing.
Oh,
Whoops.
well,
I
we've
got very
got
close.
it.
So this is from a plot plan that we had drawn up when we bought the property, and that house is roughly correct. I drew in the septic tank because I measured where it was one year when we had it pumped. So that's pretty accurate. This is a rough guess. I have a pretty good idea where it is. The only thing it's upside down, but the only thing I'm pretty sure is the size. But call that plus or minus 5 feet. The road, as I said, is at the edge of the pavement is here. And then we have, it's a stream at this point. This is wetlands going way up here and the existing shallow well. We are trying to put in a garage. The zoning board said if it's a detached garage, we have a little more flexibility. I don't know what that means yet. That's as far as I've gotten. I felt the well site was more important. And so we were looking over here for the well. I suppose if we're that close, we could also look here. I'm very uncomfortable being right on our neighbor's property line. Anyway, that's really the only two reachable spots we've got.
It seems to me that our well regs allow you to get pretty close to the property line if it is surveyed, which it looks like it is.
It was. That was because we had no idea where it was, so we had to get it surveyed.
Does anybody have the well regs up?
No.
Okay.
I have something. Regulations for providing private wells from Shutesbury.
That sounds like it must be it.
This is
If
what
you-
I got from Henshaw.
Oh. Does it have the setback list? A list of set? I can't figure out how to make this smaller, or I'd go look for it myself.
Septic, I can turn it off for a moment. If
No,
that-
don't turn it off. I
Okay.
want to keep thinking about it.
Septic tank 50 feet. Sewage disposal field 100 feet. Sewer line 25 feet, that's not an issue. Defined property line 25 feet.
Hmm.
Public way from defined property line. And as I mentioned, this is the defined property line, but the actual road is over here.
Mhm.
Anyway, 25 feet. Driveway, 15 feet. Dwellings or other structures, 25 feet. We definitely, that's less than 25 feet. This would be a detached garage.
So you said that the land drops off precipitously. Is it possible to take the well site you've got marked and move it a little bit on the diagonal within that blue donut, a little bit more toward where it says westerly? Like, yeah, like that. Is it possible to move it up there a little bit? Or is the lay of the land counter to that?
There, I can't quite tell you where it happened. There's a point where suddenly it drops. And
Mhm.
I would ask that, to me, that's what I would ask Henshaw. How far can you push it that way? How
Yeah.
far can your truck go? I'm happy with it, however far they can make it. I would be happier if it was further from the septic too.
It doesn't look like that's ever gonna happen.
Yeah.
You know, I mean, you're gonna be in the 50 to 75 range there. Now, it seems to me, Bill always used to say that you couldn't put a septic field within 100 feet of a well, but you could drill your well right down through your septic field if you were foolish enough to want to do that. So our regs reflect the distance that is recommended for septic systems. But even when we're doing a repaired septic system, we can vary the distance down to no less than 50 feet.
Okay.
So that you're still, if we could approve this, you would still be in, a reasonably safe distance. Now, as you get going in that same direction toward where it says
This way?
westerly of highway sideline, can you go into that ring at all?
Into here.
Yeah.
I don't think so. I think it, I mean, at this point in time, there's an immediate drop of like 10 feet, 8 feet.
Okay.
It's probably 6 here. And
Okay.
I'm guessing somewhere in this range is as close as we can get. So if I'm trying to stay away from the septic, being closer to the road is an advantage. If I want to get away from the road too, then I'm sort of back at the 50. Well, that's 75. I would love to be at the 75 limit and not closer.
Well, we'd like that too, I'm sure.
So this is I hope something I never see, but what happens if we put a well in here and this eventually fails? I can imagine, I don't know if you can put one that close, but I could imagine on our property putting one there or putting one here, and that's about it for replacement.
Mhm.
Yeah, probably, I haven't looked this up, but quite possibly there is a reserve area marked on the original plan. And sometimes those reserve areas are just sort of in between the trenches that are already there.
Here, I mean, it looked to me like it was for one more pipe.
Uh-huh. Yeah, I would think that it would be up where it says approx.
Yeah. But would that be an issue?
Assuming you can get in there.
Oh, that's a good question. You can't get there now.
Can't get there from here because
it's all, that would have been built before the house.
I see.
That's
So what's in the way of it?
Well, there's a shed here. I mean, I'm not sure I worry about that. It's just the slope.
I see.
We'd have to tear that slope out. It could be done. I mean, in fact, you could leave the shed and create a path. That's
Right. Well, let's hope it doesn't happen.
Yeah.
Keep it pumped, okay?
Yeah.
Any other thoughts, board members?
No, not really. It's a tough one.
It is a tough one. And what do we know about the well, Brad, the existing well?
It's a shallow well. It was dug, well, the Lions had it done 40 years ago.
Mm-hmm. And it's shallow.
It's shallow. It's
Do you know the depth?
no, I'm guessing
Mhm.
12 feet. I knew at one point, but I don't remember.
Okay.
The issue with it, well, it's got some, they didn't say how much coliform. It's not impacted us. We've not noticed. It's high salt, high sodium, which they kept saying, well, could you have road runoff? And we're 200 feet. Well, 100 feet from the road.
Huh.
Our neighbor said they have a deep well and they also have high, I think it's sodium. So I don't know what's in the ground.
On the Shutesbury side or the Pelham side?
They're in the Shutesbury side.
Uh-huh. Interesting. I can't imagine where that comes from.
Yeah. It's soft. We get blue water sometimes in the tub.
Oh,
I forget what that is, but the neighbors say they have that with the deep well, the drill well too.
Very interesting.
but the only thing that turned up on your water test was coliform. Nothing else was out of the range of normal.
Yes, they
Yeah.
mentioned that we might want to treat the sodium. They never told me the sodium. They didn't tell me how. And also to treat the, is it acidity that makes the?
Yeah. Do you have aggressive water? Does it destroy your pipes and stuff?
Yeah.
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 That you can treat with easily with there's a filter that's basically full of something like chalk that the water goes through. I have that. Yeah, that part's an easy fix. I don't know what they do for salt, but it's probably something similar. So you said before that the other possibility would be to have the well, sort of the well in the driveway reversed. I don't know that there's any advantage to that.
We had looked originally with Henshaw, we had looked over here.
Uh-huh.
I can't get too close because of the foundation wall. I can't have a truck go there.
Right.
He had suggested, well, put it down here.
Mhm.
But he also said that's 3 times the price of putting it up here because of
Ouch.
there's no way to get there without building a road. Cutting trees and building a road.
Mm.
That seems
Wow.
pretty onerous.
Yeah,
Thanks.
yeah.
So we are being asked to issue a well permit here with some setback variances, which we're allowed to do. Everything in our well reg it can be varied. So I guess
Although we
Yeah, go ahead.
cannot allow something less than 50 feet from a septic system, but we can go between 150.
yes, we definitely can go
Mhm.
between 150, and we could
Right.
probably go closer, but I wouldn't do it.
Mm.
I don't think we need to go closer.
Yeah, and as far as ways you can get, obviously, is the best. So there's the setback to the septic field. I'm not sure exactly how we are supposed to interpret the road setback That's why I wish Al were here, because we were doing that over at Sue Hoyle's house. And it seems to me that we finally ended up measuring. We measured from the center of the road 15 feet out. So from the center line, 15 feet back toward the property. And that was the end of
Okay.
the right of way.
I do have the well regs up, and as
Uh-huh.
I think Brad earlier said, there is a setback of 25 feet from, the way it reads is public way, parentheses, from defined property line, 25 feet.
That's the defined property line. I measured this one. That was 17 feet to the pavement.
Yeah.
That
Okay.
doesn't really exist anymore. It's knocked over 30 years ago. And I could measure this one too, but I'm guessing it's about the same.
Mhm.
Since I drew this, I walked out one more time and I had been thinking I had to bring the well rig in this way. But then I realized that this marker fell over. I can see where it is and I can get from the road right through here. And so I would just ask them to go back as far as they can go.
And it still should be 25 feet from a wetland. Am I right? Let's see, from a swamps, marshes, wetlands, 25 feet.
The wetlands is hard for me to delineate. I have a, I wonder where I have that. I have
Yeah,
a
so
map that,
Concom is going to need to be involved with that, as you're probably aware. And
that
our
again?
well regs say this distance shall be measured laterally from the high water mark or wetland determination bound. Any work in a wetland buffer zone requires permission of Concom prior to the issuance of the well permit by us.
Uh-huh. So that would definitely be the wetland buffer area, I assume.
I found one wetlands delineation,
Mhm.
which I don't believe. And
Hmm.
it is similar here. And then it cuts through there.
Oh,
Oh my.
This is in the center of it. Now, the part that's wet, there's a stream that's here. And I mean, I don't know what to say, but so that means I need to go to another committee and have them tell me, they may say, push it that way.
Interesting.
yeah. So Concom does need to weigh in before we can issue a permit.
However, we can tell Concom if it's so that we are prepared to issue the permit once we have their concurrence, especially if the well site moves a little bit back toward those wetlands as much as they would allow and the lay of the land allows.
Right.
The right here, the lay of the land is, this is very low. And then suddenly it climbs quite quickly. And so I think that we're fairly safe here. This, it's already there, so they don't have any choice. But that's
Right.
in a shallower part. It doesn't feel like wetlands to me. But anyway, I think we're still in pretty good shape until we reach this drop off.
Okay. Well, you guys, it looks good to me. I mean, we're always promoting drilled wells over shallow ones, especially when the shallow ones have coliform.
Yeah, no doubt.
So unless there are objections to doing so, I would say that we'll pass this on to Concom and tell them that we like it, especially with Brad, if on your thing, you'll mark about how far you think the well can move in that direction.
Yeah.
Then it will match more what we're thinking of. We'll send Concom a memo saying that that we support this, and we would issue the permit once assuming that they agree. Any objections to our doing that?
No,
Hearing none.
Oh, I have
Uh,
no objection.
Okay, all right, I think that's what we should do.
Thank you very much. Should I be writing to Conservation Committee?
Yes, yes.
Okay.
Yeah, send in an email to concom@shutesbury.org and ask to get on the agenda, or actually ask to get a site visit.
Yeah.
Yeah, I don't know who's in charge there because they lost their clerk, but somebody will answer that and get you on their schedule.
Okay, thank you.
Okay,
Sure.
I really appreciate
thanks.
it.
Good
Thanks for
luck.
coming in.
Okay,
Thank you.
bye-bye.
bye.
Take care.
Bye. All right. Okay. That was a lot.
That's
Yeah.
challenging.
It really is. That lot is very, it's long and narrow and pretty
Yeah.
wet. I can see why the Lionses were glad to leave it. Okay, so let me make a note here. Okay, we have a disposal works construction permit for a repair on 338 West Pelham Road. Fees are paid, everything's in order. Charlie recommends approval. I could probably send it to you as an email if you want to look at it, but I personally am just willing to take Charlie's word for it.
Sure.
So are we good with that? Any objections to our issuing this permit?
No objection.
No objection.
Okay. I will do it. And I'm going to issue, this is really just for information because I don't have any choice of doing this. 58 Lake Drive and 75 Shore Drive are finished and need certificates of compliance. I think at least one of those is a tight tank, but I don't remember right now. So PFAS results, we've got so far 7 results. And so we have non-detected, everybody knows where the 2 are that were positive. Non-detected, there's one pretty far down Montague Road going toward Leverett. There's one on Cooleyville Road, maybe about halfway down from the top of the hill. There's one down near the Amherst line in the sort of Atkins Reservoir neighborhood. There's one on Leverett Road getting down toward the S-curves. And there's one on the dirt part of Wendell Road. Fairly far down, but not all the way down to the elbow.
And,
So those are all non-detected.
and just to reinforce, non-detected.
And so we have 7 results out of 40 participating well owners, right?
At least
Wow.
38. Maybe there are 40, I'm not sure.
Okay.
They mentioned
So-
38 at one
So
point.
lots more results still pending.
Yeah, I wish they'd quit. Every time I look at the email, I get excited because it looks like a new result, but they're sending all the results twice.
Yeah, I saw that.
So, yeah, so that's all we have. And one person who told me she was waiting for her test kit to arrive. Apparently they thought she dropped out and she lost her chance. So I'm not sure what happened there. So yesterday there's a couple things. The Shutesbury Athletic Club, Mark Olszewski signed them up for free testing as a public water supply, but then he wanted to hand it off to somebody else because there's paperwork to do, but they're now anxious about the liability. They're afraid that they'll test and then it'll come back positive and they'll have to either shut down or spend a lot to remediate water that nobody drinks out of the tap. Obviously, I said, of course they cook there. and presumably it doesn't cook away. I said, we would talk about it at the meeting, but I assumed that the sense of the meeting was going to be testing is good and free testing is better.
Mhm.
I don't know what kind of leverage we might have here.
Yeah, they
If
are
any.
not required to test. Nobody
Mm.
has been required to test.
Right.
So,
It seems like all we can do is encourage them to do it.
mhm. I think that's right. That we can encourage, but not require.
Yeah.
Just as we could take the same stance with when it was private water well testing and we publicize that information. We could encourage it, but there isn't a requirement.
Right. Okay. I mean, it's not like they would have to shut their doors forever, but they would have to put money into fixing it if that's what if they find it there.
Mhm.
Well, I assume that we'll just want to encourage them to do it.
So I said what I said, not really knowing what's out there different for a public water supply compared with a private water supply. So was the school required to test? That's a public water supply.
I don't know if they were required or not. As a school, they probably were, but I don't know that.
Yeah.
I hadn't even realized, hadn't even thought of it in terms of the athletic club.
And the Lake Wyola Association building is also a public water supply, right, Noreen?
Correct.
Do you know whether or not there has been any word to them about a requirement to test?
I don't believe so, no.
No.
I didn't realize they were on the PWS list.
Yeah, I'm pretty sure they are, Kat.
Huh. I don't remember seeing it there before, but I haven't
okay. Well,
seen it.
maybe.
Where is it?
I may be wrong, but I think I've had a discussion about it somewhere before, and I thought they were, and I think they are. So.
Well, the athletic club and Serious Community are public water supplies, and they are
Okay.
tested frequently. And we get the results.
But tested, you mean standard testing?
Standard
panel.
bacteriological test.
Yeah.
And we don't get any kind of test results like that for the association building
Oh,
because
so maybe they're not. Okay.
I don't think it is, because it has to be open for a certain number of days out of the year, like 25
okay.
days.
Okay.
Okay.
Yeah. I don't think they meet that.
All right, but serious.
I mean, the other
criteria.
thing, just the association did put in a deep well. I'm going to say it's been a while now, maybe 7 years ago. So we did go from a shallow well to a deep well. So
Good.
yeah.
Okay, yeah, but I don't think it counts as a public water supply.
Okay.
It's got to
Good.
be like 25 people a day for 25 days or something.
Okay.
Like that. You don't have that kind of thing. So, I had sent an email to Elizabeth Steinhardt and her staff person, Caprice something, who's supposed to be in charge of our investigation here, asking if they would fast track testing of that other well on the fire station property, because people are using that water, and Becky's providing bottled water to them, not just the people who had the test, other people, the other house. And they didn't respond. And so Becky sent them an email, in the last day or two. And yesterday they sent an email to Becky that said, "We share your concerns, and to that end, Mass DEP staff are in Shutesbury today," that was yesterday, "doing preliminary research to be used in preparing our site discovery plan. In the coming weeks, we will be sampling residential wells using a state contractor." And they say that they'll likely begin the fire station area, but they're also going to do the other area.
Oh, well, that's probably good news.
Yeah. Yeah, at least they're getting started, but
Yeah, and they weren't sure
what's
about
taking
the
so
other
long?
area. Yeah,
Right.
true.
Yeah, I mean, this has taken like 3 weeks more.
Mm.
Right. Here, we thought it was urgent, but they apparently don't think so. Anyway, that's going on.
I mean, it's also hard to say what other findings they're having statewide.
Right,
This is a
That's
state
true.
testing program, so
yeah.
we have to
Right.
as well.
I know I'm not a member until tomorrow morning when Grace is swearing me in at 10:30. Am I allowed to say anything?
Please do.
Of course.
I would perhaps in your response to the athletic club and encourage them to do tests, but also say that that we're not aware of what will be required for remediation, nor are we involved in any way in adjudicating judgments about it, because their concern was liability, you said, right? And that's not really something the Board of Health.
No, their concern was that they could get either. Oh yeah, I wrote liability, but that's not really true. It's just basically that it was expense.
I see.
Yeah, that I didn't express that properly. I'm going to change it now. They're afraid that they will find out what they don't want to find out.
Like they'll have to buy water forever in bottles.
Well, what they would probably have to do, there's a filtration system that you can buy and put in. So it's a fixable problem.
Got it.
But I have heard that the people who have the seriously contaminated well spent $1,500 on the filtration system.
And that is most likely for a whole house system. So
Right.
that you're not bathing in contaminated water or watering a garden full of
Right.
plants with contaminated water. But there are point of use systems as well. So a place like the AC that's not worried about watering a garden or taking showers could install much less expensive point of use systems at the tap.
Oh, that's an interesting thought.
That's my understanding.
Yeah, the only problem with that I remember from that meeting we had with DEP people was that those point of use systems aren't calibrated to the same level as the whole house systems. But
Right.
it seems to me that one guy said that in fact they can be used because they're sort of better than their limit.
Here's the other thing to consider, though. The health risks from PFAS in drinking water are calculated with a lifetime of consumption in mind.
Right.
So for a setting like the AC, where a person comes in and maybe consumes a few ice cubes worth of their tap water, once in a while, but is not on a daily basis drinking the contaminated water, there isn't the same kind of health risk going on. So there may be different expectations for a public water supply like that than there are for a private water supply, where there's daily consumption by an entire household all the time. You know what I'm saying?
That is a really
Yeah.
good point.
Mhm.
And also different from the school.
Yes. Yeah.
Right.
Yeah.
Right, because there aren't many children.
Right.
Yeah. So that's something we need to find out.
What is something we need to find out?
Are
Can
the
you form the question?
expectations, are the expectations for a public water supply of this sort different than the expectations for residents?
Mhm.
If they, so in practical terms, if they found that the water was contaminated with PFAS at, say, 30 parts per trillion, just again, a random number. So not super high as it was over by the fire station.
Mhm.
Would they be allowed to remain open without treating the water?
Yeah, I don't know.
How can we find this out?
Because they might lump them in with restaurants, for instance,
Mm-hmm.
that are doing much more with their water in terms of dispensing their water to the public
Right.
than the AC is. When you think about the ways in which the AC is doing so at any given time, and it really probably amounts to their ice cubes,
And they're cooking.
And the
right? If
cook
they're
and their
Mhm.
dishwashing, I suppose.
right, but also, I mean, they're cooking
In the
things
kitchen.
like spaghetti in a big pot of boiling water.
They cook there, or people cook and bring it in?
They
No,
cook there.
They do cook there. Okay.
Yeah, soups are made. Spaghetti is made.
Okay.
ever,
Yep.
yeah.
Yeah. All right.
Melissa has raised her hand.
Melissa's here.
Yes,
She
yes,
is.
here I am.
Hi,
Been here
Melissa.
the whole time.
I'm just peeking in on this conversation. It's become a thing for my sister and I to take just to keep an eye on. But when they pour a drink from their soda gun, it does
Yeah.
mix with the water because it's only mixing with syrup.
I see. So that water from the seltzer gun
Yep.
is
Tap
from their
water.
well, and it's just carbonated
Ah,
along the way somewhere. Got it. Okay.
Yep,
Okay.
it goes into right. So carbonation is added,
Yep.
syrup is added. So it is
Got it.
their water. Yep.
Okay.
Just
Got it.
wanted
oh,
to,
that's good to know.
Yeah.
Hmm.
just something else to think about,
Yeah.
Yeah.
you know. Or to check with them to make sure that is the case, unless they're using something else. I don't believe the seltzer water comes in a canister from what I remember from working in food service. I think
Yeah,
it's
you're
the
probably
syrup
right.
and the gas is added to water.
Sure. I bet you're right.
So thank you. That's all I have.
Okay.
Okay.
Well, thank you, Melissa. That's
You're
good information.
I think the most important thing is to encourage testing.
Yeah.
That's the whole point of this program, is for us to
Yeah.
information and data. And I think that as the Board of Health, we should encourage them to test.
Yeah. I agree.
Totally. Yeah, and I guess there's not a lot more that we can do about that.
Right.
I mean,
We
we'll
can
just encourage
and
them
not
to do
require
it.
Yeah.
Yeah. Okay. All right. Are we done talking about PFAS?
Mhm.
Anybody have anything else to add? Okay. So I gave you a whole little story about the EDS business and how we've been lumped together with Leverett all this time. And frankly, I thought that we got separated from Leverett years ago, like formally separated. But Tracy Rogers seems to think that we're still attached to Leverett. And Noreen has brought up the point that with COVID and all the vaccination clinics and stuff, it's been much more effective to work as bigger units rather than town size EDSs. So before we say to Tracy, okay, cut the knot, maybe we should talk about it in more detail, and also talk with Leverett, because the reason we didn't do anything with Leverett is they never did anything. They were completely useless. We even invited their chair to come to our EDS and learn after we, put a lot of effort into working out our procedures. And she accepted our invitation but didn't show up. And they have just never really taken any interest until very recently. John Hillman never taken any interest in doing this emergency preparedness. And it's true for newer people. I'll say this, that a lot of people didn't, because this whole EDS structure was created at the federal level as a response to anthrax threats. And a lot of people said, anthrax, we're not worried about that. But in Shutesbury, we said emergency planning. We'll take money for that, because an emergency is an emergency. But Leverett was apparently in the give us a break category, and so they just never got into doing much of anything. Noreen, do you have any kind of sense of what they are thinking about now, or is it just John Hillman trying to do something?
No, I've talked to John, and John, they were perfectly happy to be separated out. And I think neither one of us, either town, realized that was an option for us. I think we thought that we had been lumped together to remain so,
till death do
us part. And apparently that is not the case. And we've just learned that. However, I think Tracy is coming from the fact that she has just spent, a lot of time, she and her staff, running these clinics. And I think it behooves us to think about the potential types of emergencies we might have. And if it behooves us to be linked with some other, some other EDS teams, I'd say, as an example, if we had a sustained kind of emergency that took place in our town where we had to staff something for a series of days or weeks, would we be capable of doing it just on our own and with the volunteers we have here in town? So I think she's encouraging us to think about if there should be some sort of, mutual aid kind of component to it. And I'm really wondering, Garrett's probably talking with all his towns about the same thing. So, what people are thinking. So it's not just as simple as putting together our flu clinic, which we all know we can do with no problem. But, we might be exhausted if we have an emergency that we have to respond to for 7 days or 10 days in a row, for example.
Well, that seems to me to be kind of a different thing than just being in an EDS with Leverett. And I think it's a good idea to have mutual aid and a sort of network of EDSs that help each other. And of course, there's the MRC that can help staff. But as far as just linking us with Leverett, that seems to be a different thing. See what I mean?
Not exactly. And I would say too that Leverett does have a plan. I mean, one of the things that John talked to me about this week is they have the ability to provide services, sort of year round, using their new emergency site down there, that they actually have, they don't need to use tents, for example. They can get vehicles through, existing kinds of buildings that they have, and set up in a different way. So I don't think they're as not involved as they were perhaps 20 years ago. I think they've been thinking about this more, and they do have plans in place. And I think they're taking a little more action. And as you know, we share some equipment with them. For example, they have the refrigerator.
Here's something that might work. you see John fairly regularly with NAFCO, is that right?
Yeah, and I talk to John regularly. I probably talk to
So-
John once a week or every other week.
Oh, no kidding.
Yeah.
So maybe he would come to a meeting of ours one time and we could kind of
Yeah,
talk
sure.
things over. That seems like the best way of dealing with that.
Or I mean, the other thing is maybe we want to, you know, meet with a couple of members of their board, although I think he's the one who's most active with their EDS team. And I think, and the other thing he has told me is they are having some major turnover on their EDS team, that one of the members
Oh.
who's been heading it up, and I forget his name for some time, is leaving the team.
Uh-huh.
You know, from my perspective, the most significant problem with the planning has been having it be centered around worst case scenarios. And so, you know, if you, from a medical countermeasures perspective, if you set anthrax and a pandemic emerging infectious disease aside, the likelihood that a community like Shutesbury or even Leverett is going to set up an EDS to dispense a medical countermeasure for a disease that requires it, you know, so even like hepatitis A is pretty low probability. And so, you know, kind of the, not to call it routine or run of the mill situation, but really to call it that, the likelihood that we're going to do that here is pretty minimal. And the experience with COVID has demonstrated that the likelihood that we're going to set up an EDS to vaccinate our population is pretty low probability. So I'm not against the perspective that Tracy's perspective that she's presenting. I think we have to look at what our options are, you know, in terms of what makes the most sense from a perspective of shared resources and doing this in a way that is collaborative. Because I think that that's, you know, all of the complaints about the mass vaccinations aside, vaccination clinics aside, the fact of the matter is we're at 80% vaccination rate.
Yeah, they worked.
So, you know, I think we have to look at this experience and try to figure out, is there something that we can gain from it? And do we need to make some adjustments to the way that we've planned for these types of events?
It seems to me that from what you're saying, that there needs to be some planning and some rethinking on a larger scale than just individual towns. That thinking about the towns working collaboratively within the county is going to be perhaps more beneficial, right? Because really, whether Shutesbury is the Shutesbury EDS or the Shutesbury Leverett EDS,
Right.
is a kind of a really small
Yeah.
matter compared to, do we have capacity within the whole county for mutual aid and for taking care of our local needs.
Yeah, that's exactly right.
So that was kind of what I was getting at before, that it's almost immaterial whether we go in with Leverett or not. Right? That's kind of not the question that's being asked here.
Right. I think the question was only being asked for the intent of updating our plans. You know, I think it was that simple, but it is a broader question, which we're now discussing now. And I think MAFCO needs to discuss and with FERCog for sure.
Yeah. Well, maybe we should just push that back up toward them and right. Let them come up with some ideas about how we can collaborate better with our neighboring towns. So in any case, we don't have to take any action on this. This is just kind of
Well, I think,
Yeah.
I think they already put something in the plan, and I don't know what they put. I think they put in that we're requesting to be individual EDSs now. I think those plans
Okay.
were due earlier on this month. But it's, what we have learned is it's not, it's not until death do us part that we can
Right.
change it, so.
I swear, I thought this had already happened. And I wonder if things got mixed up, possibly by Lori. Because I thought we had already established that we were separate. So I don't know.
If so, it was a surprise to John and myself that,
Okay.
I thought we
Well.
were stuck together forever, and I wasn't,
Yeah. It's been confusing.
Yes.
Anyway, that's something for the future, but that's kind of the picture of it. Shall we move on?
Mhm.
Okay, so I've been talking with Becky about hiring a part-time clerk using the same funds that have been used to pay me for part of the work that I have done, and the part that I actually still occasionally draw on. I haven't been taking payment for the kinds of things that would come out of our line item, our Board of Health line item. I've just been volunteering that. But I'm thinking that we ought to start thinking about the future, and having a clerk and organized systems and somebody to take some of the toil out of this would be really helpful for me. And so Becky's going to bring this up with the personnel board tomorrow night. There are now like 3 meetings, maybe 4, and a dinner invitation that I have turned down so that I can get away for a few days, and like nobody wants to let me go. But anyway, I think I sent you a list of tasks that the clerk would do. Did you guys have a chance to look at it? Did I leave anything important out? That's what I'm really focused on.
I think not. It seems to me like you're separating out some of the tasks that you would be interested in continuing to do for a while anyway, Kat, like writing
Yeah.
our minutes and writing articles for our newsletters and writing educational pieces for the community, that type of thing. You wouldn't expect a clerk to do at this point.
Right. And I wouldn't expect, and possibly never. I mean, I don't think that a clerical position would actually include the public education or public information piece. And that seems to me to be for the board members.
Yeah.
And I'm happy to be doing that part with
Okay.
the help of all of you. And as I recall, there was something else I left out that I said, let me look at this. Matters relating to infectious disease reporting, the kind of stuff that Arlene does, I would just want to leave alone.
Yeah.
Right. And probably stuff that has to do with the EDS, to the extent that we do it.
Would we want to add sort of routine communications? So the routine messages that come in via email or phone message?
Yeah, I think we would, so that person could be the one who monitors the phone. I mean, I don't mind checking the email, but I constantly forget about the phone. I never think of the phone. So let's add that.
And probably relevant here, could I ask if you have any plans to return to in-person meetings, or is this going to be Zoom forever?
It's not going to be Zoom forever. I don't think we're going to be allowed to Zoom forever. But there's some legislation that allows us to continue Zooming at least until September and maybe till January. Melissa, are you still here? Do you know the answer to that? Or is she gone?
She's trying to unmute.
Oh,
I don't usually
she-
use my cell phone, so sorry about that.
oh,
Yeah, from what I know is the legislation, the temporary legislation gives us until the 15th, and then there are some parameters for further. I know
the
the select-
15th of what?
September. September.
Okay.
And the select board's looking into ways for the select board to be able to meet and still include those that want to attend virtually. So I think it will extend that to everybody if that's the way we go, like a hybrid. I'm not sure we'll ever go back to just in-person meetings. I don't know. I think our world has changed in some way. But right now it's to the 15th. I know we do have a couple of committees that can't meet except for in person, so they haven't really been meeting. So it's still kind of up in the air, but at least until the 15th, we have permission for virtual.
But it's not required.
No, I don't think so. And I think each community can decide what they want to do but it was a way so we could figure that out.
Yeah, well, the reason I'm asking that is not so much for the Board of Health, but for their Lake Wildlife Advisory Committee, which I'm the Board of Health representative for. We would like to start meeting in person, even outside if necessary, because some of the people on the committee don't Zoom, and they're important. And we think that we'll get better attendance if we go back to in-person meetings.
Let me ask I don't know if you need select board permission or anything like that. So let me ask at our next select board meeting and have Becky get back to you on that, just to double check. I think that should be okay. We will have to go back to doing something in person at some point, you know?
Yeah, supposedly June 21st, town hall opened, although I noticed the door's still locked.
Yeah, no, we changed it to the 28th and because
Oh, I
the
missed that.
Yeah, so we had changed it to next Monday because it was a mess downstairs, and you know, not having it open kind of had things go into little nooks and crannies. So Becky asked for time to get that cleaned up and more presentable to in person.
Oh, I see. Okay,
So,
good to know.
this
Well,
Monday,
I'm happy to say that the Board of Health didn't make a mess. We got all our tents and stuff out of there really quick. I should add that Arlene and I went to fold up the tent covers the day after town meeting, and Arlene brilliantly brought along wonderful Cliff, and we got all the canopies folded up and in their boxes, and the canopies and the tents and everything else up to the shed in less than an hour.
Oh, that's
good work.
unbelievable. Yeah,
great.
pass that secret on.
Yeah,
That's like folding a fitted sheet.
Right.
Yeah,
yeah,
really.
Exactly.
right.
Wow.
Gigantic
right.
fitted sheet.
right, with
Yeah,
multiple angles.
Yes.
Yeah.
right.
That's
Right,
great
yes.
work.
So that was really great.
Yeah, thank you, everyone.
And
I think you get the gold star for town
Yeah,
meeting to be able to put everything back and to get it all set in that length of time.
Yeah.
for sure.
Yeah.
the reason I asked about the meetings, though, it would even a transition back to some hybrid format affect your job description for a clerk at all?
Oh, that's a good question. Maybe a requirement of knowing how to use Zoom or some sort of, maybe it's more of a educational part.
Yeah, I wouldn't put it, basically what I'm trying to just list is just the duties of the person. And really, if the clerk isn't going to be doing the minutes, which I would be willing to keep, hang on here, I got a low battery. Am I gonna, yeah, I'm gonna come back. Really, what I'm looking for is somebody to do the town hall part of things, right? The phone and the mail and the filing and the database management and all that kind of stuff. So no, I don't think that, in answer to your question, Wim, I don't think that it would change the job description that much.
To Wim's point though, so Al or I are mainly managing the Zoom platform piece of this.
Mm-hmm.
And so if we did move back to a hybrid piece and all of us are meeting in person, I think it might be helpful to have the clerk take on the control of the Zoom platform.
Mm.
So if we're all there participating in meeting in the Board of Health meeting room, it might help to do that.
That'd be great. Yeah.
Yeah, that would be great. But since that's kind of a future thing, I mean, basically, I'm just giving the general layout here. It's not a formal job description. Just this is what I'm looking for somebody to do.
Mm-hmm.
But yeah, that is a good point. It would be great to have somebody whose job it was at the meeting just to manage that stuff, let people in the meeting and mute them if they're bad and right, and whatnot.
I will announce that Al Warner has joined us.
Al,
Al,
we thought you had abandoned us.
He's not on audio yet.
Uh-huh.
He's
Still
connecting.
Connecting,
Yeah.
yes. Cameo appearance. Maybe with trouble connecting to audio.
You know why he's connecting now? Because of the last agenda item, which is planning a party, and that's the part he doesn't want to miss.
No, he's connecting because he forgot.
That's
my
also
guess.
possible.
Either that or he's been riding his bike around.
Or his motorcycle. Anyway, oh, there he is. Now he's on audio. We're talking about you, Al.
We're making fun of you, actually.
You're still muted. If you're trying to speak to us, you're muted.
Maybe he doesn't talk to us.
Now he's unmuted.
Yeah, but you can't see me, can you? I'm on my
Well,
phone, so
No, but we see this dashing picture of you.
Yeah,
Right.
you might as well keep that one up, Al.
Yeah.
yeah.
It's better than real life anyway.
What? Hey, I resemble that.
Vaguely, yeah.
Yeah. What you don't know about that picture is I'm standing next to a glacial Lake Manly sign out in Death Valley.
Oh.
Yeah.
Okay.
So it says Manly right next to my hand.
That should be part of the picture. That would be excellent.
Yeah. Well, I have to be careful about stuff like that.
Yeah.
Yeah, true.
Yes, you do.
Right. In your work.
Yeah.
Not with us. Not with us.
So I don't have any excuse for coming in late. I just totally spaced it out.
What did I say? What did I say?
Yeah, that's exactly what you said. We should have called you, but
I called that
didn't.
right, Al.
Yeah.
yeah.
I bet that you had just forgotten.
Yeah.
But your timing is perfect, actually, because we've already done any business that we have to do. And now we're going to talk about having a party.
Oh, party. Yay.
Yeah.
So I thought that was going to be after we adjourned.
Well, yeah, why don't we
Is that-
adjourn because it's not business and we don't need to have it as part of the meeting. And I have on my desk here notes, descriptions from the open meeting law, and it says specifically that we are allowed to go to social events as long as we don't deliberate. And frankly, I have
Who
no
wants
wish-
to?
I don't
Right.
want to. Yeah, right. Anybody who deliberates is going to be thrown in the lake. So I suggest that we adjourn now at 8:15 and stay on and see if we can if we can make a plan, even if it's just egg.
Thank you. I'm gonna say goodbye and let you guys have that conversation. Thank you for letting me slide into your meeting tonight. I appreciate it.
Well,
Well,
thank you
you're
for
always
joining us.
coming, Melissa.
Always welcome. Thank you, Melissa.
Thank you. You have a good evening.
You
You
too.
too.
Thank
Bye.
you.
Bye.
Bye.
Okay, so shall we adjourn?
Yes.
Yes.
All right,
sure.
we are adjourned, and you can turn off the
I will
thing.
stop recording.
All
I
right,
love-
thanks.
Of short meetings.